Good morning, and welcome to the second annual Beyond Silos Symposium. Buenos días, y bienvenidos al segundo simposio anual Beyond Silos. I'm Rebecca Melendez with the East Los Angeles Women's Center, and I have the honor of being your Master of Ceremonies for the day. We have over 500 people with us. Thank you all for being here today. For a few announcements before we dive in, feel free to use the chat throughout the day. However, with an audience so large, we will not be able to bring specific questions to the speakers. For those needing Spanish interpretation, please click on the tab that says Sessions to join that room. Be sure to mute the audio on the main stage. Para las personas que necesiten servicios de interpretación, por favor hagan clic en la pestaña que dice Sessions. Se les moverá a un espacio con intérpretes que estarán presentes. Siempre seguirán viendo el video en el escenario principal. Por favor, asegúrese de silenciar el audio del escenario principal para escuchar solamente las intérpretes que pueden usar la cajita del chat para hacer sus preguntas. All the sessions will be recorded, and you will have access to the recordings and speaker slides after the symposium. That information will be emailed to you. For continuing education credits, please click on the CEU links located in the reception area. Please be sure to complete the conference evaluation at the end of the day. The link to the evaluation is located in the reception area. For those wanting continuing education, you must complete the evaluation for credits. We are so grateful to our sponsor who has made this conference and this work possible. A huge thank you to Blue Shield of California Foundation. Please visit the expo to view our sponsor and partner booths during the breaks or after the conference. Lastly, the conference room will remain open until 4 p.m. Pacific Standard Time, allowing you time to network with each other, visit the booths, and complete your evaluation. Today is going to be phenomenal. To get us started, I'm happy to welcome Karen Earl. Ms. Earl is the CEO of Jenesse Center Incorporated, the oldest domestic violence intervention program in South Central Los Angeles. Jenesse is recognized as one of the first shelter programs founded by African-American women who were themselves survivors of domestic violence. Karen began her association with Jenesse in 1989. Welcome, Ms. Earl.
Good morning, and thank you so much, Rebecca. It's certainly an honor to participate today. You mentioned 1989. Back then, I could not have imagined such a collaboration. Then we were in our little silos, seeing what was happening in our unique communities, knowing the issues, but not feeling that there were tangible ways to make a difference. Outside of just working by ourselves. So these collaborations really give us the opportunity to go beyond what's in our neighborhoods and come together and make a bigger difference. So I'm so delighted to be with this work and do this work in conjunction with the Community Legal Aid of Southern California, YWCA of San Gabriel Valley, East Los Angeles Women's Center, just really working to make a difference, to make sure that survivors have access to care. And this work began, I guess, organically in 2014, and when Blue Shield funded from 2014 to 2017. And then this group, this collab, like, hey, let's keep this going and meet and figure things out, and it has grown, and here we are today in collaboration with the County of Los Angeles Department of Health Services. And so I think those of us in our individual organizations know we have seen women suffer. We have a client who came to us for domestic violence, but we saw that she had cancer. So we were able to connect her and heal her and her family across the board. And this could not be done without amazing supporters like the Blue Shield Foundation of California. And it's my honor to introduce Lucia Corral Pena, who is a thought partner we can noodle ideas with, and who really wants to make a difference, and they prove it and they actualize it. Lucia?
Thank you so much, Karen, for that wonderful introduction. It is my privilege to be on a screen next to you. Welcome, everyone, and on behalf of the Blue Shield of California Foundation, I want to welcome you to this event. As Karen said, I am Lucia Corral Pena. I'm a Senior Program Officer at Blue Shield of California Foundation. I'm excited to be here alongside the Leadership Council as we work together beyond silos to break the cycle of domestic violence. Along with the Leadership Council, I'd like to thank the Los Angeles County Department of Public Health and the Board of Supervisors for their partnership and leadership in this work. I hope today's conversation will inspire you to think and act across the domestic violence and healthcare sectors with renewed energy, new ideas, and the passion that you just heard in Karen's voice and that really drives many of us to make change in our communities. For almost 2 decades, the foundation has partnered with organizations, leaders, and advocates throughout the state and across the nation with the goal of ending domestic violence and creating safety for survivors. And it is through those decades of work that we've learned that breaking the cycle of domestic violence means we have to find ways to stop it before it occurs. This means first understanding the conditions that allow for domestic violence to remain a pervasive issue in our country, in our state, and right here in Los Angeles. It means addressing its root causes, which include poverty and racism. It includes dismantling harmful gender norms and gender inequity. And it also means addressing healing from trauma to stop its intergenerational impact, because we know that children exposed to domestic violence are more likely to experience it as an adult. As many of you know, on the healthcare side of this partnership, it's vital to treat the immediate needs of patients. But attention must also be paid to how we prevent poor health in the first place. And the very same is true for domestic violence. But unfortunately, so little is invested in terms of funding to prevention. And we have to look at the current system responses and ask some key questions like, how much and how far are we investing in prevention, healing, and the type of safety that changes lives in the long term? As we all think today about going beyond silos, each one of us recognizes that domestic violence does not happen in a silo, and that long-lasting solutions cannot be siloed either. Today's conference has brought together a range of leaders, practitioners, experts, and survivors. You may work on the front lines in public health, as an educator, or as a policymaker. You may be a health funder like myself. What we all have in common is that we see the pathway to success is through partnership and collaboration, and that changing systems is possible, and that solutions rooted in lived experience cannot lose. While the pandemic has exacerbated inequities, it has also brought forth powerful movements for racial, gender, and economic justice. And with a spotlight on these issues, we have the opportunity to reimagine as we rebuild. And as we rebuild, we are seeing more public support for new ideas to address domestic violence. Just this year, a poll funded by the foundation found that 91% of Californians view domestic violence as a serious societal issue, not a private issue. And that's really important. Californians strongly support alternatives to jail for those who cause domestic violence, and strongly support assistance for those who experience domestic violence, such as help with childcare, food, housing, transportation, and cash assistance. For this reason, the foundation recently funded almost $2 million to the Women's Foundation of California to support 130 domestic violence organizations statewide as they recover from the pandemic. This type of grant allows organizations to allocate funding in the most valuable ways as they work to meet the unique needs of survivors during this time. And I invite funders on this call, both public and private, to do the same. Domestic violence is a health equity issue that requires a broad range of solutions to ensure healing and prevention. Public systems can be more responsive to the priorities and needs of communities most impacted. Systems like health, housing, employment, banking, criminal justice systems can all be partners. We know, though, that systems can cause harm and be obstacles, especially for marginalized communities. But systems can also open doors. They can open doors to healing, well-being, and opportunity. Most of you here today work every day to make that a reality for the people you serve. And for this work to succeed, survivors, families, and communities most affected by domestic violence must be directly engaged in building the solutions and holding systems accountable for that change. I will close with a short story and an invitation as you start your day. 8 years ago, as Karen mentioned, when the foundation started working at the intersection of domestic violence and health, we did so in partnership with community health centers and domestic violence organizations and visionaries like many of the members on this leadership council. The vision was to realize a piece of the vision of the Affordable Care Act, which was to make real a new provision in the act that would support the healthcare system to be more effective for survivors by mandating reimbursement for domestic violence screening. We learned so much through that work. We designed for collaboration and designed for impact. We funded training of clinic staff at all levels and bidirectional referrals between health and domestic violence organizations. But here's what we did not design for, and it was one of the most important unexpected outcomes of that work. In almost all partnerships, we found that healthcare workers were self-reporting for help from the domestic violence advocates that they were being trained from. That was so powerful. We did not design our evaluation, and in retrospect, it makes so much sense given the pervasiveness of domestic violence. But my invitation for all of you today is to be curious and be open to those unexpected insights that you can take back to your organizations that can drive deeper change at the intersection of domestic violence and health. Now, before I pass the mic to the next speaker, who is a visionary champion of justice, the Honorable Holly Mitchell, Supervisor of the 2nd District of Los Angeles County Board of Supervisors, I want to thank her for her leadership. In Sacramento, she was a tireless advocate for survivors, for low-income women and their families, and she's showing the same type of leadership now as an LA County Supervisor. But I also want to thank her for helping grow the next generation of women leaders. For many years, she has worked with the Women's Foundation of California and its Women's Policy Institute to teach policymaking to emerging women leaders from communities who are doing direct work with patients, with survivors, with community members. We too, as a funder, have been a funder of the Women's Policy Institute, and we are just thrilled to be a partner with the Honorable Supervisor Holly Mitchell. I just want to appreciate Holly and Karen as well for pulling up young people, young women into positions of leadership. So with that, I want to thank you all for being here, and I'm passing the mic to you, Supervisor.
Lucia, thank you very much. And I'm let me see, I'm gonna reach over there and I'm taking the mic from you. Boom. I love StreamYard. It's a good thing. Good morning, everybody. Thanks to Lucia for that amazing introduction. I appreciate your generosity. And I just have to say, Karen Earl, I had to count on my fingers and toes. Since 1989, that's 32 years, sister. That's a long time that you have been at the forefront of this issue, particularly for Black women, given Jennesse's history and role. And so please know how deeply on a personal level, I appreciate your commitment, your vision, your fight. I have been alongside you many of those years, and I know it has not always been easy, but for us, you have been a constant in this space. And for that, I thank you. And I really appreciate being invited to participate in this really important convening. The Beyond the Silo Symposium is really an important opportunity to elevate this conversation about the increasing rates in violence in our homes and in our communities and society as a whole. And I hope it helps start conversations that lead to local solutions to address multiple forms of violence, again, including domestic violence and all forms of violence. You, as healthcare professionals and healthcare organizations, are major assets in a community's effort to prevent violence. You serve as important first contacts for many of our most vulnerable populations. Doctors, nurses, and other healthcare workers play a key role in assessing and linking, excuse me, your clients and patients to critical local resources. This pandemic, as we all know and have experienced it personally, has exacerbated many pre-existing challenges, including access to stable employment, affordable and safe housing, food security, and virtual and digital access to education and health services. Given this landscape, it's not surprising at all that we've been seeing increasing rates of violence in the county, and particularly in my second district. In areas of LA County served by the Sheriff's Department, compared to the same period in 2019, as of May of this year, the number of homicides and gun-related aggravated assaults have nearly doubled. Homicides increased 85%. Gun-related aggravated assaults increased 90%. In real numbers, there were 412 in 2019 and 784 already for 2021. These impacts haven't been universally experienced, but they continue to widen historic disparities among racial and socioeconomic divides. Now, we all know, the drivers of violence, and most often it's economics and the pressure that brings to bear. We all know what really governs public safety. It's not necessarily more police in our communities, but really dealing with these systemic inequities that have plagued far too many of our communities for far too long. The Department of Public Health's Office of Violence Prevention has developed a comprehensive strategic plan to prevent violence in LA County by building an infrastructure, increasing access to shared data, and working towards a stronger crisis trauma response team and appropriate response team. Another priority of the office is to invest in community-driven safety solutions through its trauma prevention initiative, which was first implemented in unincorporated communities of South LA back in 2016. This place-based approach links various public health tools, such as community engagement and outreach, violence interruption, hospital violence intervention programs, and connections to essential county and community supports and services. In support of these violence prevention and healing efforts, my office spearheaded efforts very recently to approve a $5 million fund expansion of these community-driven strategies to more communities in the county, and a $1.3 million over 3 years pilot program called Crisis Response Pilot, again in South LA. Our goal is that it will provide peer outreach and resources for community healing. I'm very proud of those two actions we've taken. You all who know me know that I chaired the budget committee when I was in the legislature, and I believe in the power of resources and funding efforts that we know actually work. The second district has also helped spearhead the allocation of $20 million American Rescue Plan to fund community-based organizations to implement crisis response, again, disrupt violence, and promote healing. I believe that's the most appropriate use of the American Rescue Plan dollars from the federal government. We know that multiple forms of violence share common underlying risk factors. Exposure to one form of violence increases the risk of further victimization and engagement in violent behavior. So we've got to build community assets and engage multiple partners like you're doing to address risk and develop resilience. I know as well as you that violence is preventable. Recently, my staff had a chance to visit the Recuperative Care Center on the campus of Rancho Los Amigos. The center houses residents with complex health and mental health problems who need treatment and care that a hospital setting doesn't appropriately provide. The community agency that runs it talked to my staff about the efficacy of putting up a simple sign. They literally have a sign that has the word violence in the middle with a red circle with a line going across it, like the strikeout. And basically the sign says no violence is allowed or acceptable here. It's fascinating. The staff, they report that once they put that sign on the wall, residents, it is a reminder to residents of their dignity and the dignity of everyone sharing the space. Another key component of their process is not just the sign, but they also train staff to de-escalate situations. So together, these steps, they believe, have dramatically reduced violent incidents in that setting. I found that to be very powerful. So if you take away one thing that I've shared with you this morning, I hope it will be this, that we each can do something in our own way, in our homes, in our communities, me as a policymaker, you as service provider, to stop violence. No act is too small. By working together, we can create a future where all children can thrive across LA County. I appreciate the invitation today. I look forward to hearing about the outcomes of your discussions and solutions that you derive throughout your deliberations today. Thank you so much for the opportunity to share words with you. Thanks, Rebecca.
Thank you, Supervisor.